yesterday's video, like yesterday's class. So let me elongate the screen. So as we have already discussed the types of blockages and about its treatment. Yeah. So as you remember, we have discussed about coronary artery blockage, about like we have gone through deeply only regarding about coronary artery blockage. So today we'll be learning about sinoatrial blockage and about AV node blockage. Or what we also call it as junctional blockage. Okay, so as you have discussed in the earlier class, like we have discussed about coronary artery blockage and the prophylaxis regarding it. So today we will be going through about sinoatrial blockage and AV node blockage, or we also call it as junctional blockage. So let me mention it down here, junctional blockage. So let us start with the first the second type of blockage, what we also call it as sinoatrial blockage. So like what is the forum of discussion here? So like as the term itself defines here the sinoatrial blockage, we are known with the phenomenon that the SA node, or what we call it as sinoatrial node, is the pacemaker of the heart. Why it is called as pacemaker pacemaker of the heart? Because it is the only excitable tissue in the heart which generates impulses. So as there is a generation of impulses, there will be like recurring of heartbeat. So like today we'll be discussing what if there is a blockage found in sinoatrial node, and we'll be discussing thoroughly about it in the aspect of ECG, what you call it as electrocardiogram. So we'll also look into the recording of ECG whenever there is a sinoatrial blockage in the heart. So let us go. So the first point comes here is this this phenomenon is demonstrated as a stated form. So if we take in terms of ECG, as you are known about the ECG record, the normal ECG record will be like this. This is the P wave, this is the Q wave, and this is the R wave, this is the S wave, and this is the T wave. This is the normal ECG record of a person. Okay, I think you're all familiar with the notations and the indications of PQRST waves. Like how much should be the length of P wave in terms of graphically. So like I'll be discussing thoroughly about ECG in the next class. So In this class only I'll be discussing only regarding about blockages and how we see in the aspect of ECG record. So if you take in sinoatrial blockage, usually there will be sudden cessation of P waves with a resultant standstill of atria. There will be no formation. If you take it graphically, if you take it in ECG form, there will be normal, in the first rhythm there will be normal PQRST wave continuously. Then suddenly what happens is, due to the blockage, there will be no formation of P wave. Usually what we call P wave in terms of ECG, it is defined as atrial depolarization. P wave indicates the atrial depolarization of the heart, but due to blockage in the sinoatrial node, there will be no depolarization occurring in atria. So there will be no formation of P wave in the ECG. So which helps us to indicate in the patient that there will be a continuous gap over what is this. The line which we call it as is called as isoelectric line. The line which is present after the after a period of the repolarization of T wave. I'm sorry, I forgotten to form a P wave over here. So let me correct it down. Yeah. So let's go. This is the T wave. Okay. Then there will be sudden cessation of formation of P wave, what you call it as atrial depolarization. There will be no deep atrial depolarization is seen. The first point we'll write it down over here is no atrial depolarization is seen in sinoatrial blockage. Means there will be sudden cessation. Cessation means ceasing anything, stopping of any stuff or anything is called as cessation. Sudden cessation of, because there is no forming of P waves after some time. So this is the first thing whenever we see if a patient has got sinoatrial blockage, then he will be if you take the ECG record of his or her, then the first phenomenon we see is there will be cessation. There will be no atrial depolarization waves seen, what you call it as P waves, because P waves indicates about atrial depolarization, but there is no atrial depolarization occurring in the heart. So then there will be no forming of P waves. So that is the first thing. Okay, I hope you might have got this point. So this is the main key point which we usually define about sinoatrial blockage. So I'm just highlighting this point because this is one of the main point which has to be mentioned during whenever we are defining about sinoatrial blockage. Then the second thing will be the second thing, which is usually, I'm sorry for the middle interruption because this is I got some stuff in between. So the second thing will be usually ventricles will pick up, usually the ventricle which is present in the heart, because it is usually responsible for pumping of the blood. The right ventricle is usually responsible of pumping of blood to the aorta. So usually the phenomenon in this part is the contraction of ventricle is totally dependent on atria. So we will be learning it in the upcoming blockage when we will be studying about junctional blockage. So we will get to know why atria is dependent on ventricular contraction is dependent on atrial contraction. So usually the generation of the impulses is from SA node. So like whenever there is a stimulation of SA node, the impulses get transferred to the AV node. Do you know how the impulses gets transferred from SA node to AV node? It is through by a bundle of branch called what we call it as Bachmann's bundle, which is present in the right atria. Bachmann's bundle is usually responsible for transmission of SA node stimulation, SA node from AV node. So whenever the impulses get transferred from SA node to AV node, whenever the impulses are transferred from SA node to AV node, there is a phenomenon where the impulses which are transferred from SA node to AV node, so sorry for the spelling mistake, so let me correct it down. The impulses are stopped in AV node for about 0.1 second. So let me explain this phenomenon. Whenever whenever there is a generation of impulses from SA node then it gets transferred to AV node with the help of Bachmann's bundle. So whenever the impulses reaches to AV node, so there will be a delay in transmission of impulses from AV node to ventricles in order to contract the ventricles. So as I have said earlier, atrial ventricular contraction is totally dependent on atrial contraction. So let me mention this point again. Ventricular contraction is totally dependent on atrial contraction. So I will be explaining this phenomenon later when we will be talking about AV node blockage or junctional blockage. So just I'll mention the point. Ventricular contraction is totally dependent on atrial contraction. So usually what happens is there will be, as I have said, there will be delay of transmission of impulses from the AV node. There is a delay of transmission of impulses from AV node to ventricles for about of a period of 0.1 second. So this is the phenomenon, there is a delay of transmission of impulses from AV node to ventricles of a period of 0.1 second. So usually when there is a blockage seen in sinoatrial node, if there is a blockage seen in SA node, then what happens is ventricle will start its own impulses, what we call it as ectopic impulses. So we'll be learning about the ectopic impulses and ectopic formation of the waves in ECG. So we'll be learning about it later. So just I'll mention what is the key thing which is required to learn about a sinoatrial node. So if there is a blockage seen in sinoatrial node, then ventricle will start contracting with the help of ectopic impulses which are generated from another part of the heart, which are generated from the other part of the heart. So whenever there is a generation of ectopic impulses, so like usually the ventricle contraction is totally dependent on the atrial contraction, which are where the impulses are transferred from SA node to ventricles. But what happens here is, even if there is a delay in like about 0.1 second in AV node, the ventricular contraction doesn't bother about the delay of AV node, because they are getting impulses from another part of the heart. So the impulses which they are getting which helps them to contract is called ectopic impulses. So if you define what do you mean by ectopic impulses, means the impulses which are generated from any other part of the heart except sinoatrial node, because sinoatrial node is the one of the major excitable tissue which are responsible for generation of impulses. So if there is any generation of impulses seen in the heart from the other part of the heart, then when we define that those impulses as ectopic impulses. So let us take in the form of ECG. So as I have mentioned, the ventricles will start contracting with the help of ectopic impulses. So like usually what happens is, like there will be formation of QRST complex from in an altered form. So if I explain you in terms of ECG, like as I have said, there will be cessation of P waves for some time whenever there is a sinoatrial blockage seen in the heart. So I'm sorry, this is the ECG pattern which is seen in patients who have got a sinoatrial blockage. So this is the ECG pattern of sinoatrial blockage. So whenever we see, so whenever we see this kind of pattern in ECG, then we can conclude that the patient has got sinoatrial blockage. So usually what happens here is, there will be contraction of ventricles. Like you might be knowing, you might have studied in cardiac form, is QRST complex, or if you take only QRS complex, it defines as the ventricular depolarization. Means there will be contraction in ventricles seen. So due to that, whenever as I have said, there will be cessation of P waves, or there will be no forming of P waves in in terms of ECG pattern. But sometimes what happens is, often there is a formation of isoelectric line for some time. There will be no formation of P wave in the sinusoidal blockage. But sometimes what happens is, if you take it in ECG form, so like after some time after the formation of isoelectric line, there will be no forming of P waves, but there will be a formation of QRST complex, which is seen over here. You can see this is the QRST complex. So I'm sorry, this is the QRST complex, but there is no formation of P waves. So now you can manipulate what I have said earlier is, there is no formation of P waves even after, like, for a period of after some period during the formation of isoelectric line, but there is only formation of QRST complex. Do you know why there is a formation of QRST complex? As I have mentioned earlier, the ventricles are getting the impulses from other part of the heart due to the ectopic impulses. So let me write it down over here. Due to ectopic impulses, there is only formation of QRST complex, but there is cessation of P waves seen, means there is no formation of P waves. Do you know why there is the cessation of P waves seen? As I mentioned, the term itself defines due to the sinoatrial blockage, as it is present in the right atria, there is no contraction of right atrium seen. So due to the SA node blockage, there is a cessation of P wave. So as I have explained, if we take in terms of ECG pattern, due to the ectopic impulses which are generated from any other part of the heart, so the ventricular it takes the advantage of those ectopic impulses and start contracting itself, rather than being dependent on atrial contraction. So due to this, there is a formation of only QRST complex, but there is a cessation of P waves seen, means there is no formation of P waves seen here. As we have mentioned, there is no P waves seen here. So I have not got enough space here, so I'll write it down only this much. So there is no P wave seen here. So let us talk about when does the sinoatrial blockage occur? What are all the factors which may lead to sinoatrial blockage? So the first one is either if there is any myocardial ischemic attack to the sinus node, or as you know, if there is factors. So let me write it down over here in a proper manner. Factors which can lead to sinoatrial blockage. So what are all the factors which may lead to sinoatrial blockage? The first factor is if there is any myocardial ischemic infection seen in sinoatrial node. If we for example, if we take myocarditis, it is a type of inflammation which is it is a kind of infection which is usually seen in myocardium layer of the heart. Usually heart has got three layers. One is epicardium, myocardium and endocardium. So myocardium is one of the most important layer which helps in contraction of heart. So if there is any infection found in myocardial region, so it may leads to sinoatrial blockage. And the second factor which may also leads to like sinoatrial blockage is due to, like, if there is any side effect of certain medications, like if you take one of the most important drug, like if I give one example of any drug, if you take atropine, which is a cholinergic drug in the sense it activates the sympathetic system of our body. So due to high dosage of atropine, or due to certain high dosage of any cholinergic drug, or if you take anticholinergic drug also, then there are side effects that which may also leads to sinoatrial blockage due to any other certain medications which are taken in a high dosage manner. Then it may also leads to sinoatrial blockage. Hope you might have got this topic. I hope you are able to manipulate what I am delivering about this. So in the next class we'll be taking about the atrioventricular blockage. Sorry, I'm not having enough time to elongate the video, so I have to stop here. So I thank you all for your attention, and goodbye. Have a nice evening. Thank you so much.